Hello, I'm Varsha Abhishek and I work as a dietitian and counsellor for Khushi IVF and Fertility, JP Nagar, Bangalore, run by Dr. Rashmi Yogesh. Gestational Diabetes Mellitus has become one of the most common ailments these days, and medical nutrition therapy is the first line of treatment for gestational diabetes mellitus. And 90% of the cases of diabetes can be treated with nutrition therapy, and sometimes when it goes a little higher, then of course we'll need to take medical support. But the nutrition part is extremely crucial. And how we take care of patients with GDMS, we prepare a very customized meal plan for them. We take in consideration their history, their records, their other clinical data, their glucose recordings, their socioeconomic backgrounds, their eating patterns, their meal patterns, what kind of food they like, their dislikes and likes, and then we make a very customized plan which is very easy for the pregnant women to follow. The primary goal of medical nutrition therapy when it comes to GDM, that is gestational diabetes, is to prepare a carb controlled meal where we distribute the required carbohydrates throughout the day into smaller, more frequent meals. It is very important to make sure that there is no too much of carbs taken at a single meal so that the normoglycemia can be achieved. It is very common for the carbohydrate resistance to be high during the mornings. This is called as a dawn phenomena. So the best way to tackle this is to make sure that the breakfast is divided into 2 halves and they eat it with 2 hours apart. This makes sure that the sugars don't spike. Apart from this, another important thing is to always include a protein with a carb. That combination is very important in diabetes because the proteins don't let the carbs spike sugars and make sure that the carbs are utilized well in the body. So when we prepare a plate that the diabetes patient is eating, there should be a protein and there should be a lot of fiber. So these 2 things help in controlling the sugar levels, making that the sugars don't spike. And another important nutrient which is very important in diabetes is omega-3. So by including food which is rich in omega-3, sugars can be controlled pretty well. And there are a few important things that needs to be considered and needs to be avoided completely. Breakfast cereals, which are fortified with a lot of vitamins, but they're also very high in sugar. Carbonated drinks, bakery items, sweets, desserts, saturated fats, all these things need to be completely avoided. Also, there are food and fruits which are high in glycemic index like simple sugars and starchy fruits. All these need to be completely avoided. We also recommend light walks after every meal, maybe around 15 minutes of light walk, not brisk walk, which also helps in controlling sugar spikes. And ultimately, the final thing is, helping the patients and teaching them how to record and how to maintain a record of their glucose levels, how to self-monitor, and teaching them why and what they should eat and what is good for them. That is also extremely important.